Hello, Clinic Review family. It's good to have you here. Today we're going to be talking about iron deficiency anemia. I cannot promise you that it's going to be on the Nclex, but it very likely is going to be on any of those standardized tests you have to take while you're in school. And it certainly is possibly going to be on Nclex. So let's go ahead and learn a little bit about it. It's not that complicated. Hello, my friends. It's Dr. Sharon with Clinic Reviews. Thank you so much for being a part of our Clinic Review family. Today, we're talking about iron deficiency anemia, which is not particularly complicated, but I'm not going to really teach on it because obviously anemia is measured by looking at the hemoglobin. And when the iron is low, that causes hemoglobin to be low. So it's not that complicated, but I'm going to do a few questions with you. It's going to be sort of a short video just to make sure that you're able to sort of think through some of the causes, risk factors, symptoms of iron deficiency anemia. You know, this channel is part of the Greater Clinic Review organization. We offer the very best Nclex review in the entire universe, in my opinion. You can go to clinicreviews.com to sign up for our 21 plus hour Nclex prep course online on demand. We also have a streaming service and a small group tutoring package that you purchase as a monthly service. So let's go ahead and get started. Which laboratory findings support a diagnosis of iron deficiency anemia? Low hemoglobin, low serum ferritin, low total iron binding capacity, low mean corpuscular volume, elevated reticulocyte count, low transferrin saturation. All right, so we're looking at findings, laboratory findings. So we'll just do a little teaching about laboratory findings here. Low hemoglobin, that is the definition of anemia, low hemoglobin, so yes. Low serum ferritin. Ferritin is just another word for iron, essentially. So when you measure iron level, you measure ferritin level, so you're going to have a low ferritin. Low total iron binding capacity. So it's not lowering the capacity to bind with iron, it's just lowering the amount of iron in the body. So that's not that doesn't support the diagnosis of iron deficiency anemia. Low mean corpuscular volume. So it's just the size of the red blood cell. So it does tend to be smaller when you have a lower iron level. So that would be true, low mean corpuscular volume. Elevated reticulocyte count is not consistent with iron deficiency anemia, and low transferrin saturation. So transferrin, transportation, ferritin. This is a protein that transports iron. So if you have less iron, you're going to have less transferrin saturation. So those are the lab indicators of iron deficiency anemia. Which of the following are causes of iron deficiency anemia? Chronic blood loss, poor dietary intake, hemolysis, malabsorption disorders, chronic kidney disease, or autoimmune disorder. So let me teach you how to answer questions where they ask about causes or risk factors or symptoms even, and then it's a SATA question. What you want to do is take each answer and relate it back to the question itself. This prevents you from overthinking or to forget what you're being tested on, and you're answering the question that's being asked. So chronic blood loss is a cause of iron deficiency anemia. Now that one I have to think about a minute. Chronic blood loss, a cause of iron deficiency anemia. That is not something that I think right off the bat that's a cause of iron deficiency anemia. So let me just teach you. Red blood cells carry a huge amount of iron. Most of the iron in our body is carried in red blood cells. So if they have chronic blood loss, they're actually losing a lot of iron along with that. So actually chronic blood loss, while a cause of anemia in general, it's also a cause of iron deficiency anemia because they're losing so much iron in the red blood cells. Poor dietary intake is a cause of iron deficiency anemia. Well, that would make sense. We get our iron from what we eat. So if we have poor dietary intake, then that would be a cause of iron deficiency anemia. Hemolysis. Hemolysis is the breakdown of red blood cells. So they're not losing iron. If it breaks down, the iron stays in the body. And so it doesn't really cause iron deficiency anemia. Malabsorption disorders, just like B, D is the same reason why they have iron deficiency anemia. They may be taking it in, but they're not absorbing it. Chronic kidney disease is a cause of iron deficiency anemia. So chronic kidney disease is a cause of anemia, but it's not a cause of iron deficiency anemia. Autoimmune disorders are a cause of iron deficiency anemia, not that I know of. I don't know why that would be the case. The only reason I might say autoimmune disorder is a cause of iron deficiency anemia is if it's an inflammatory disorder, like a GI tract inflammatory disorder, and they lose a lot of blood. But that's overthinking it. Okay. So what you don't want to do is you don't go, well, I know people with ulcerative colitis can be having a lot of bleeding, right? You're way overthinking it. You want to say, in general, are autoimmune disorders a risk for iron deficiency anemia? And the answer is no. Which of the following symptoms are expected in iron deficiency anemia? So symptoms. All right, fatigue, pallor, glossitis, tachycardia, night sweats, or peripheral edema. So let's do the same thing. Fatigue is a symptom of iron deficiency anemia. Well, that makes sense. It's a symptom of anemia, so fine. Pallor is a symptom of iron deficiency anemia. Yes, any type of anemia would have pallor. Glossitis is a symptom of iron deficiency anemia. Glossitis, itis, is inflammation. It's actually an inflammation of the tongue. It gets kind of beefy red, more red and inflamed than usual. That actually is, you just have to memorize it, I guess, a symptom of iron deficiency anemia. Tachycardia is a symptom of iron deficiency anemia. Well, if they have less oxygen carrying capacity, if they're low hemoglobin, because anemia is low hemoglobin, they have less oxygen carrying capacity, and the body's going to try to make up for it by becoming increasing heart rate, right, to get more blood out. So yes, tachycardia is a symptom really of any type of anemia. Night sweats are a symptom of iron deficiency anemia, not that I know of. I've never heard of that before, and I don't want to pick something that I haven't heard of. Peripheral edema is a symptom of iron deficiency anemia, not that I know of. I've never heard that before, so I'm not going to pick ones that I haven't heard of before. So you want to use your common sense and clinical reasoning when you're answering SATA questions. Remember, SATA questions are not about what list did you memorize. They're usually, almost always, about a concept that they're testing you about. The only one here that I would say you had to memorize was glossitis. That's not something that just naturally comes to me. And so I would rather have you under-select than over-select, because we're prone to over-selection. Our first impulse is to go, well, I don't know, maybe. And so we pick it. I want to cover all my bases, so I pick it. So I'd rather you under-select in that. Control your impulses to cover all your bases. Okay. Most of the time when you're picking one because you're not sure, most of the time it's not going to be right, and you do get partial credit on SATA questions. So I'd rather have you control those urges to over-select. Which intervention should the nurse include in the care plan for a patient with iron deficiency anemia? Okay, care plan. Encourage intake of vitamin C rich foods. Administer iron via IV if oral supplementation fails. Suggest a high fiber diet. Encourage intake of calcium supplements. Assess for occult blood in the stools, or monitor for signs of hypoxia. All right, iron deficiency anemia. So I want them to take, let's see, intervention. So I want them to take iron for sure. And they can take it orally, but if that doesn't work, they can do IV. So I like B for sure, administer iron via IV. Now, one thing I know, and this is something you are going to have to just learn, is that vitamin C actually helps the absorption of iron. So we're going to pick A. So just remember, vitamin C helps the absorption of iron. However, fiber does not. Fiber doesn't really help the absorption of very much. We usually tell people to avoid taking supplements of any kind with fiber. It doesn't mean you can't take fiber. You just don't want to take fiber with your supplements, like take it separately, maybe a different time of the day, because fiber does not help with the absorption really of any supplement. Encourage intake of calcium supplements. So calcium supplements, vitamin C, don't get confused between calcium and vitamin C. Calcium supplements do not help with the absorption of iron, but vitamin C does. Assess for occult blood in the stool. So interventions the nurse should include in the plan of care. Well, I would think if they're iron deficient, because it can be from chronic bleeding, it can be from poor iron intake, right? Or malabsorption syndromes. So I do want to know if they're bleeding. So E sounds like a really good idea to check for occult blood in the stool, monitor for signs of hypoxia. Well, if they're anemic, I want to assess for signs of hypoxia. So those are the correct answers. So again, remember, it's not about what you memorize. It's about understanding things conceptually, knowing how things work, understanding how iron is given. What are the risk factors? How do people become iron deficient anemia? Which is why the previous question, you knew that chronic blood loss can lead to iron deficiency anemia. So then we know E is correct to assess for chronic blood loss. A nurse is evaluating a patient's understanding of dietary sources of iron. Which food selection indicates appropriate knowledge? Oranges and bananas, chicken breast and white rice, spinach and lean red meat, or yogurt and almonds. I hope you know that spinach and lean red meat is the correct answer on that. Which statement by a patient with iron deficiency anemia indicates the need for further teaching? Which statement by a patient with iron deficiency anemia indicates the need for further teaching? So I'm looking for the false statement related to iron deficiency. Further teaching means false statement. F goes with F. Further teaching goes with false statement. I should take my iron supplement with milk to reduce stomach upset. So I like taking it with food. I mean, okay with taking it with food if they have to, because it can cause stomach upset. But milk reduces the absorption of whatever you're taking. So we don't usually recommend taking meds with milk. You can take them with food, but not usually with milk. I may feel constipated while taking iron supplements. That's true. It can really cause a constipation. I should eat foods like red meat and spinach to increase my iron intake. That's true. My stool may become dark while taking iron supplements. That's true. Iron can cause the stool to turn black, which then makes you think they're bleeding, but they're not. They're taking iron. So if you have a patient with black stool, ask them if they're taking iron. That may be the cause of it. So the one that I think requires further teaching is taking it with milk. A patient with iron deficiency anemia asks why their stool is black after starting iron supplements. What is the nurse's best response? Best response. So we're looking for a true statement. This may indicate GI bleeding. Contact your provider immediately. All right, so black stool can indicate GI bleeding, but specifically they just started taking iron supplements, and I know iron supplements can turn the stool black, so I don't really want to say that. I don't really want to say, A, this is a normal side effect of iron supplements. That's true. That's very true. This means your body is rejecting the iron supplement. That's not true. You need to increase your dose of iron because it's not being absorbed properly. That is not true. So I'm going to choose the one that's specific to them having just started taking iron. So don't overthink it. Don't go, I got to cover all my bases. They could be bleeding. No, y'all, they just started taking iron. You know, iron turning stool black is a side effect. So don't go freaking them out. Tell them they're probably bleeding. A patient with iron deficiency anemia is prescribed ferrous sulfate, which is an iron supplement. Which instruction should the nurse provide? Take an antacid to prevent stomach upset. Take on an empty stomach with orange juice. Take at bedtime with a glass of milk. Take with meals to enhance absorption. Okay, take with an antacid to prevent stomach upset. So which instruction should you take? Okay, provide for iron taking in. All right, antacids. Don't ever take anything with an antacid. Antacids should always be taken by themselves. They prevent absorption of anything that you take with them, meds included. So that's just across the board. An acid should be taken a half hour before other meds or an hour after other meds. So that's sort of the rule. If you're given the option for an hour before or 2 hours after, that could also be appropriate. So maybe an hour before, 2 hours after, or a half hour before, hour after. Anyway, it has to be taken. It can't be taken with other meds. Take on an empty stomach with orange juice. So I know things are absorbed best on an empty stomach. Orange juice has vitamin C, which helps the absorption of iron. So I like B, take at bedtime with a glass of milk. Well, I just said I don't like milk with iron because it prevents absorption. So I'm taking that off. Take with meals to enhance absorption. So I don't mind taking it with meals, but taking it with meals does not enhance absorption. So the best thing for iron is to take it on an empty stomach with orange juice. You don't have to take it on an empty stomach with orange juice. You can take it with meals if it really bothers your stomach, but you shouldn't be taking it with milk. And I would never take any pills with an antacid. A nurse is caring for a patient with iron deficiency anemia. Which symptom would the nurse most likely observe? Bradycardia, jaundice, cyanosis, or pica? All right, iron deficiency anemia, which symptom would they most likely observe? So I know bradycardia is out because tachycardia is more likely to occur. Jaundice is out. That has nothing to do with anemia. So I say, well, cyanosis. So they're anemic. Could they become cyanosis? They could become cyanotic. That's a pretty extreme thing. If you're that anemic that you're going to become cyanotic, that's extreme. Pica. So I put this question in here actually to teach you what pica means. Pica is the urge to eat foods that are not even foods, eat things that often are crunchy and don't have any nutritional value. So pica, often they eat dirt, but ice cubes, probably for people who don't want to eat dirt. They can also have a strong craving for chewing gum. So that actually, pica is a symptom of iron deficiency anemia. So I'm not picking cyanosis because that's not really a symptom. That's more like a complication. Symptoms are things that you go, okay, I'm not that surprised. If someone all of a sudden starts craving ice or constantly chewing gum or eating dirt, I'm going to say maybe we better check your hemoglobin. A patient with iron deficiency anemia has a hemoglobin level of 6.2. What is the nurse's priority intervention? Encourage iron-rich foods, teach the patient about taking iron supplements, administer a blood transfusion as prescribed, monitor for signs of infection. So Clinic Reviews teaches lab values. So I'm just going to give you a little heads up about how one of the ways we teach lab values. When we teach lab values, we teach them as A, B, C, or D labs. We say A labs are abnormal, but you don't have to do anything. B labs are abnormal, but you have to assess something. C labs and D labs are abnormal and you have to do something. So a hemoglobin of 6.2 is actually a C lab. It doesn't tell you anything about them except they have iron deficiency anemia. So you go, okay, so they have iron deficiency anemia, but even so, 6.2 is low enough that I have to do something, not just assess something. So anything below 8, you have to do something. And the most important thing to do once it's under 8 is to give blood, because that's very low. So if you encourage them to have iron-rich foods or take iron supplements, it's going to take a long time to get their hemoglobin level back up, right? So I might do that if it was a little higher, but I'm not going to do that if I have the option to give blood. And I'll tell you, A and B are essentially the same answer. So here's a testing strategy. On a single choice answer question, when 2 answers say the same thing, neither one of them is right. So eating iron-rich foods or taking iron supplements, that's essentially the same thing. How would you choose between them? Well, I would tell them to eat the iron-rich foods because it's better to do natural. Okay, who said that? Who says better to do natural? Maybe they don't have access to iron-rich foods. So taking supplements or eating iron-rich foods are essentially the same intervention. They're low enough. Anything under 8, I recommend that if you have the choice to give them a blood transfusion, that you give them a blood transfusion. A patient with iron deficiency anemia has a hemoglobin of 8 and reports dizziness. Which action should the nurse take? So they have an 8 and they report dizziness. So that's symptomatically low. Encourage slow position changes. Well, that's good with dizziness. You know what? Let me read the answers first. Encourage slow position changes. Administer IV iron. Provide supplemental oxygen as needed. Instruct the patient to avoid strenuous activity. Notify the provider of the lab result. Increase dietary protein intake. So I don't have the option to give blood. So I definitely want to assess. I would like to see where the bleeding is coming from. I want to make sure they're safe related to the dizziness. And I don't know if there's anything else I can do. So let's see. Encourage slow position changes. Well, that's safety related to the dizziness. So I like that. Administer IV iron immediately. They're iron deficient, anemic, and they have a hemoglobin of 8. Administer IV iron immediately. I don't like the word immediately. I just don't like the word immediately. So I'm going to hold off on that. Provide supplemental oxygen as needed. I like the word as needed. That is a good Nclex answer. So yeah, if they need it, I'm going to give it. Instruct the patient to avoid strenuous activity. That seems like a good idea. They're dizzy. Let's not do strenuous activity. Notify the provider, definitely, because it's low and they're dizzy. Increase dietary protein intake. That doesn't seem like it would help. Okay, so the question, let's go back to the administer IV iron immediately. The reason I'm not going to pick that is I don't like the word immediately. Iron, IV iron is not an emergency intervention. Giving blood is an emergency intervention. Giving iron is not. Phew, I couldn't remember what the right answers were. So I didn't pick it because it had that sort of extreme word related to an intervention that is not an extreme intervention. Giving iron is something that we do. It's a scheduled thing. It's not an emergency thing. And here's why it's not an emergency thing, because it doesn't work right away. We can give iron, but it's not going to bring their hemoglobin up to 10 like in 2 hours. If they need anything to be done now, we're going to have to give blood. And so I would call the provider, maybe they would order blood. I don't know if we're going to give blood because 8 is sort of on the border. So the provider is going to have to make that decision. But giving iron immediately as an emergency is not going to help them now. A nurse is caring for a patient with iron deficiency anemia with a hemoglobin of 9.8, down from 11.16 months ago. Which action is the priority? Okay, so their hemoglobin has dropped. Start the patient on IV iron therapy, maybe. Administer prescribed proton pump inhibitor, maybe. Doesn't say anything about GI bleed. Guaiac stool according to protocol. That seems like a good idea. Provide high iron meals. Okay, so it's dropped and I don't know why, right? They have iron deficiency anemia and it's dropped, but I don't know why. Could be iron. I have two give iron options, IV iron or IV or iron meals. So remember when I told you when you have a single choice question, a question that requires one choice and you have two answers that say the same thing, neither one of them is right. I don't know how to pick between A and D. They're both saying the same thing. Now, administer prescribed proton pump inhibitor. They've dropped about 1.5 points in 6 months. I don't know that it was a GI problem. I don't know that. Now, if I guaiac the stool, that means I'm assessing something. I need to find out. We need to find out why they might be bleeding. It seems like guaiacing the stool is a good idea. Okay. All right. Well, I hope that was helpful. I know it's short and sweet. Maybe it wasn't short and sweet. Maybe it just was to me because some of my videos have been getting kind of long. So I hope you have a great rest of your day. Thanks so much for being a part of the Clinic Review family, and I'll see you later.